Welcome. Thank you for tuning in to this presentation from the Choices Community of Practice. The Choices Community of Practice includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. The goal of the Choices Project team is to support these efforts by providing tools, resources, and training opportunities. We hope you enjoy this presentation and find it informative. Thank you for joining us.
Hi everyone. Today I'm going to discuss REACH, which is a key component of the Choices model and framework. We have two learning objectives for today's discussion. First, you should be able to describe the Choices methods for estimating strategy REACH, which means who and how many people will be impacted by an intervention. Additionally, you should also be able to describe the methods that we use for identifying REACH data sources. Identifying the strategy population REACH helps to provide information that answers questions related to what individuals will be affected by a strategy, including who has the potential to benefit and who will benefit from the strategy. This process for identifying a strategy's population REACH helps us to determine potential approaches for creating model projections or quick estimates. We use data from published estimates for adoption, participation, and enrollment, or use other supporting documents to make educated assumptions about the population that is being impacted by a strategy and who will receive the benefits. We also sometimes make assumptions as needed based on the experiences of practitioners and researchers. For Choices REACH estimates, our data sources often come from relevant studies, state or local surveys, or national data sets, like the National Center for Education Statistics, which can provide us information on the number of students in each school district, or, for example, the American Community Survey, which can provide data on demographics or other population characteristics. To start estimating population REACH, we begin with an all-inclusive population, and then we apply inclusion and exclusion criteria to help narrow down the description and the number. And then we end with those individuals who would likely benefit from the specific intervention strategy. There are some important considerations, though, that we need for estimating REACH, such as the geographic area of interest, who the policy or program is intended to impact, the characteristics of the participants of the relevant published studies that we're using, such as their age range or the setting, and also how a strategy will be implemented. There are important other considerations for estimating REACH as well. We need to ask ourselves questions: is there any evidence of inequity in terms of access to a strategy? Does race or ethnicity, gender, or income impact whether an individual is likely to receive the benefits of that given strategy? So now that we've thought through all of these questions, we can get to work. To estimate REACH, we first start with the total population, which, depending on the strategy you're looking at, could be at the national, state, or local level. Then we apply those inclusion and exclusion criteria to focus on the relevant population. These are individuals with relevant demographic and socioeconomic characteristics and enrollment or participation status. After estimating the relevant population, we can focus on the eligible population. These are individuals in the settings or locations that do not have a current applicable policy or program. Next, we look to the intention to treat population. That's the eligible population that could potentially adopt or receive the intervention strategy. And finally, we narrow down to the population that would benefit. This is the segment of the intention to treat population that actually adopts and implements the strategy itself. The population can be examined by measures of adoption or compliance. So now I'd like to walk us through an example of how we can estimate the population REACH for a specific strategy. I'm going to use the example of a regulatory policy that sets limits on the amount of screen time that children aged 2 to 5 can view television or other non-educational media in child care centers that are licensed and regulated by a state. First, we note the total population of the state. Then we determine the relevant population. So in this example, that would be children ages 2 to 5 in licensed and regulated child care programs that must comply with regulations. Then we determine the eligible population. In this example, that would include those children aged 2 to 5 in the licensed child care programs without a current applicable policy or program. And then we narrow this down to the intention to treat population. And in this example, that would include those children aged 2 to 5 with licensed child care programs that don't have a current applicable policy or program that also agree to implement the new policy. And then finally, we narrow our benefiting population. In this example, that would include children aged 2 to 5 in the licensed child care programs without a current applicable policy or program that also agree to implement the new policy and then comply. This gets us to our final population that would benefit.
Thank you for tuning into our presentation. You can learn more about the Choices Project, our research, and the community of practice by visiting our website at choicesproject.org.